Are you pregnant and not sure where to start when it comes for labor and delivery prep? Well, you're in the right place. My name's Molly. I'm a physical therapist at Revitalize PT, and I'm here to show you the 4 best stretches in preparation for labor and delivery. Stay tuned through the whole video as I'm going to leave a special nugget of information right at the end that will put you ahead of the curve when you go into labor. All right, ladies, our first exercise is belly breathing. I'm gonna have you start by laying on your back with your knees bent. You're gonna place your hands on your lower abdomen and rest your head on the floor. What you'll work on here is drawing the air downward into the lower abdomen, thinking of having lungs down in the pelvic region. You wanna put one hand on your chest. The movement up at the upper chest should be limited. You're working on getting movement down into the lower hand. So it's going to look like this. Inhale, belly raises, exhale, belly lowers. Inhale, belly raises, exhale, belly lowers. You're gonna repeat this for about 3 to 4 minutes, 2 to 3 times a day. What you should feel is a relaxation of the pelvic floor and a slight recoil of the pelvic floor as you exhale. Inhale will draw extra air down into the lower abdominal region, and it's going to stretch the pelvic floor muscles. This will also help activate your parasympathetic nervous system to help you relax as well. I find it helpful to use a slow, controlled inhale through the nose and then a nice, relaxed exhale through the mouth. As long as you can stay relaxed through the whole thing, you're welcome to exhale through your nose as well. This exercise can also be tried in side lying, and you can place one hand underneath your head and one hand on the lower rib cage. As you inhale, that lower rib cage will start to expand upward towards the ceiling. Our next exercise is going to be a deep squat. So there are some modifications for this if you're getting pain. Maybe have a set of yoga blocks with you or be sitting near some stairs at home. You're going to go up onto your feet, and then you're going to work on putting your elbows on the inside of your knees and using the palms of your hands for additional support outwards. So you want to work on getting the lower shins to move outwards a little bit, and you can see that opens up through the front of the pelvis here. And you're going to work on sitting in this position for about 1 to 2 minutes at a time. If you start to get a lot of aching on the front of your hips, that's okay. You can always do a little bit of a weight shift, or like I said, do a little bit of extra support from the yoga blocks, so you'll still get that added benefit of the stretch despite the support happening at the pelvis. If you're able to progress yourself, you can always remove one yoga block. You do want to work on trying to keep the spine nice and straight with this. If you kind of crumble and round at the spine, that's going to defeat some of the purpose of the stretch. So you might feel some stretching kind of on the inside of the thighs. You should feel some opening and stretching deep down into the pelvic floor as well. If you are limited in your mobility and your ankles and you're not able to attain this position, you can always roll a towel and put it up behind your heel so that your heel is slightly elevated in reference to the forefoot, into the front of the foot. Good, so this one's going to work on pelvic floor muscles as well, and some of the deeper hip rotators that will help you get ready for when the baby's lowering down into the pelvis. Our next exercise is called the happy baby. So it looks just like it sounds. You're gonna do this position laying on your back, and you're gonna grab on the inside of either foot and pull downwards and out at the feet. In this position here as well, you may feel some stretching on the inside of the thighs, down into the pelvic floor, and possibly down into the low back, and even at the front of the hips. You want to be conscious of any subconscious clenching. If you're squeezing your glutes or if you're tightening your pelvic floor muscles, you won't get as much benefit. So even adding some of that deep breathing to this exercise can be helpful. So you can see I'm pushing down through my shins to bring my knees closer down to the floor here. And this one you'll also hold in this position for 1 to 2 minutes at a time, repeating several times per day. You should feel some slight discomfort, but not any acute pain. If you have trouble tolerating the happy baby position, laying all the way flat on your back, you can always do that in a semi-reclined position, putting pillows up against your headboard on the bed, and then just leaning into those pillows and doing the stretch that way as well. All right, ladies, our last stretch for the 4 best stretches in preparation for labor and delivery is a deep lunge. And you're gonna work on opening up the front of the hip and the leg that's behind you. So I'm shifting my weight towards my front leg and allowing the stretching across the front of the hip on the leg that is back. So I'll just show you from the side as well. Now I've got my left hip stretching across the front and a deep stretch on my right hip in the back. You do want to keep a nice neutral pelvis here. I don't want to overextend my back and I don't want to round my back. I want to keep nice and upright and shift my hips forward into this front leg. Take note not to overextend here, as that could cause additional pain and pressure, and it's also going to turn off the stretch. This position you're going to work on holding for about 1 minute on each side, trying this a couple of times a day as well. You do want to be cautious with the deep lunge if you have pubic bone pain, as that deep lunge position can kind of move that pubic tubercle in the pubic symphysis right in the center where the left and right pelvis meet. So if you do have discomfort, just make the lunge either through less range of motion, or if you have pubic pain, try to avoid this. Okay, ladies, if you're looking for a few more nuggets of information in preparation for labor and delivery, I would like to introduce to you the idea of perineal stretching. This is stretching of the pelvic floor muscles that is done internally, either by yourself or the help of a partner or a physical therapist, and it works on reducing the tension in the muscles to help reduce tearing during labor and delivery. So be sure to click the link above, and that will get you some information on how to do perineal stretching at home. Hope you guys enjoyed this video. Let us know if you have any questions in the comments below.